Hello, it's Mr. Brown, is it?
It's Mr. Brown,
Hello,
yes,
yeah.
yes, and as I say, I'm not very happy with things at all because I don't know if you've been looking after my dad, but you know, I mean, he's got cancer, colon cancer or something, whatever that might be, but you know, I don't think it's really good enough at all because he came in 6 months ago and had some tests and was rather, seems to have been fobbed off with some, you know, blood transfusions and things, and you know, sent home. There's been no follow-up at all or any sort of, you know, follow-on at all, and really I don't feel this is, well, it just isn't satisfactory. I'm sorry, it is not good enough, this. You know, I know the health service has got problems, but that doesn't give an excuse for you know, a misdiagnosis.
Okay. See, there's obviously quite a lot of things that you're concerned about there, and it sounds like.
Well, I'm concerned about my dad. I mean, why on earth it wasn't picked up? You know, as I say, he was here for tests 6 months ago, and they just seem to find very little apart from, you know, giving him some blood, you know, blood transfusions and things, and you know, it all seems to be rather slapdash, to be quite honest.
Okay. Well, I don't think I got a chance to fully introduce myself and explain who I am and what I'm doing here, so I'll start with that for a start. So my name's
Right.
Dr. Olsen. I'm one of the junior doctors on the ward.
Right.
The first time I met your dad's been this admission, so I've not met him before.
Oh, so you weren't involved the last time?
No, but obviously I've read through his medical notes,
Yeah.
so I know about what's happened.
Yeah.
I've just had a quick chat with your dad, and he said he's happy for me to sort of talk to you
Sure,
about
okay,
things.
well, yes, oh yes, he would be. Yes, because I said I'd have a word.
So should we start from the very beginning then? It sounds as though something happened 6 months ago that perhaps we should talk a little bit about first.
Well, I mean, as I say, he's, you know, he's 70 now, he's getting on, and as I say, he was admitted 6 months ago for tests. You know, he'd been very tired and dizzy and everything, and they did various tests, and they don't seem to have found a great deal. There was something called HB or something, I'm not quite sure what that was. And as I say, he was sort of discharged, but after that nothing happened at all. There was no sort of follow-up. Haven't seen, you know, and it's only this time when he's come in that you know, it's discovered he's got cancer, and this could have been discovered 6 months ago, and something, you know, he could have been getting treatment.
Okay.
You know, I mean, what you said you've seen the notes. I mean, what do you think about what's been going on?
So when he came into hospital 6 months, I think he actually came in with a heart problem, didn't he?
Yes,
by
yes.
the sound of it, as though he'd had a heart attack when he came in that time. And you're quite right that he'd been feeling unwell and had some dizziness as well as those problems.
Yes, that's right, yeah.
And they found that he was quite anemic. So
Yes,
his
that's
blood
right.
count was
Yes,
quite
and he
low.
had these blood transfusions.
And that's that HB
Yes,
you're
that's the
referring
anemia,
to.
yes,
Yeah.
yes.
So what they did then was they gave him a blood transfusion.
That's right.
Okay, and so they corrected that.
Hmm.
And I think the plan at that point was to look into the reasons why he'd become anemic.
Yes, yes, and nothing has happened since then.
So
I mean, there's just no follow-up at all. I mean, what's the point of coming in if you don't get the follow-up at all?
and sure, and that's something we can talk about in a moment. But just to explain, the reason why they didn't do any tests when he was in hospital at that time was because he'd had the heart attack.
Right.
So if you do sort of very invasive tests or tests like camera tests like he's had this time, very soon after a heart attack that can cause more problems, so it can, in the worst case, lead someone to have another heart attack. So normally, if we find someone's got a problem like your dad had, like the anemia, when they come in with a heart attack, we don't investigate it straight away. Okay.
Right, okay.
We let the heart problem settle down, if you like, and then usually would plan to do some tests.
Yeah, well, that's fine. I can see the logic of that. Now, that's fine. But then surely the whole point of this is, because you can't do it at the time, you do it later, you follow it up, and nothing has happened. And really, I mean, how much time has been wasted? You know, we've lost an awful lot of time. And, you know, when he could have been getting treatment for this cancer, and probably it's now, you know, I mean, how far has it progressed? And, you know, I don't know. I mean, it's just so, you know, it's just unbelievable, really. It's unbelievable.
Well, normally when someone goes home from hospital and there's a plan to follow them up, a couple of things happened.
Just didn't happen.
One thing is that we write a summary of what's happened in hospital, a discharge summary, and we send that on to the patient's general practitioner, and they normally get a copy of that themselves as well.
Yeah, well, I mean, the implications of this are, are pretty serious, really, because, I was going to say bordering on negligence. I wouldn't say that. I would say negligence, to be quite honest.
So,
without this follow-up.
Of course, yeah.
As you yourself have said, it should have happened.
No, I
and
understand.
it didn't happen. So what's the hospital going to do about it?
Well, so I can see from the notes that last time that had been the plan.
Yes,
there had been a plan for him to, to be followed up and investigated for this, for the blood count being
Fine,
low.
you keep telling me this, but it didn't happen.
What I don't know immediately is exactly why that didn't happen, and that's clearly something that we need to investigate.
Well, yes. I mean, you yourself are saying it should have happened. So, I mean, obviously something's wrong in the system, and it's obviously the fault of the hospital, isn't it? It must be.
Clearly there's been a mistake's been made, because your dad should have been followed up. I'm glad
you agree with that.
But I don't know at this moment exactly why that didn't happen, and that's what we need to find out. We need to find out where this went wrong.
That's one thing, but I mean, what damage have we done, or was the hospital done, to be quite honest, in the meantime? I mean, what's his outlook for regarding the cancer?
Okay, so perhaps if we come on to that just in a moment, but just to finish what I think we should do about the fact that your dad wasn't followed up.
Okay.
I mean, clearly that's something we need to investigate. I think that's that's an incident that I'll report to make sure that the sort of the management system in the hospital looks into that very promptly to find out why your dad wasn't investigated.
Well, there needs to be a very, very good reason, certainly.
To find out why that didn't happen, and so really to prevent that happening, anything like that ever happening again, because clearly that's not acceptable, and we need to get
for
to the
other
bottom
patients
of it.
too, and in this particular case, I mean, there's this firm of solicitors with an advert as you come into the hospital. I might well be talking to them, because I don't think we should let this rest, at all. I mean, yes, you should look into it for future patients, but in this case. So anyhow, I'll be having a word with them to see what they think.
Yeah, and there is also a something called PALS, or Patient Advice and Liaison Service, that you can go to if you've got a problem or an issue.
Too,
with the
yes,
hospital.
yes. Although they probably doing a lot of covering up for the hospital, won't they?
No, they're independent, and they would give you advice and help you sort of deal with this and see how you might wish to take it forward. But certainly it's something that we will be looking into, and obviously we'll be keeping you up to date about that.
Well, yes. Oh, yes, I shall certainly expect that.
So if perhaps we talk about, you were saying about
I was going to say,
so
what's going to happen to Dad? I mean, I mean, it's just not good enough. But so, I mean, how far is this cancer advanced?
Okay, so from the information we've got, we've done the tests that we've done, the colonoscopy, so the camera test, and so that's told us that there is a cancer there in the bowel. And we really need to do some further investigations to find out, whether or not that's just within the bowel, or whether there's hang on, sorry a moment. We've done that already. Sorry. So we've done the camera test, and the camera test has shown us that there's a problem. The cancer's in the bowel. The samples have confirmed that. And then we also did something called a CT scan. I don't know whether your dad told you about that.
He said he had some tests, didn't say what they were.
And so that's really to look at whether or not the cancer still looks as though it's within the bowel, or whether it looks as though it's spread anywhere.
And has it?
And it looked from that test as though it hasn't.
It hasn't.
Actually.
Oh, that's something
so
at least.
On that test, at least, there's no evidence of spread of
something,
the cancer.
I suppose. Yeah.
So it looks as though we're dealing with a problem that's primarily, contained within the bowel, if you like, so a bowel cancer.
Right, so what will this need? An operation, or what will it be?
I mean, mostly the first treatment for a bowel cancer would be an operation to remove it. Some patients need additional treatments like chemotherapy or radiotherapy as well. And in some patients they need that either before or afterwards. In some patients, surgery is not an option for whatever reason. So there's lots of different possibilities. I think the main thing that we need to do is to get your dad to see a cancer specialist. And that's the priority now. The cancer specialists are called oncology doctors. And what will happen is they'll come and see your dad in the hospital. Okay, I would hope that that'll happen later on today.
I hope it would, in view of the delay, yes, and I shall be very annoyed if it doesn't.
They'll have the biopsy results and the scan results available to them, and normally what they do is they discuss the cases in a team with surgical doctors, their colleagues, the x-ray specialists and sort of cancer nurses as well, and then as a group, as a team, they would make a decision about the best treatment option for the patient, so the best treatment option for your dad in this case. And so taking everything into account, those results, and also your dad's sort of, usual health and any other problems he might have. And then they would sort of make the treatment plan, if you like, the specialist treatment plan as the best way to take things forward.
Well, I hope it's going to be prioritised. Well, I would expect it to be prioritised, because otherwise, seeing as how it's the fault of the hospital that he hasn't had the follow-up, I would certainly, at the very least you can do is to absolutely prioritise this. And, I mean, okay, he hasn't seen the specialist doctors yet, but I mean, in your view, is he going to, respond to treatment and recover? I mean, it's not life-threatening or anything at this stage, is it?
Well, cancer's obviously a very serious condition, and as I said, the good thing is that it doesn't appear as though there's any spread, but, on the scan that we've had, but that is just one investigation.
Yeah.
And clearly the specialist doctors need to have a look at that and all the other information and make a decision.
Yeah.
But I think it's certainly a treatable problem, and hopefully there's something that we can do to make this to make the situation better. But the specialist cancer doctors are really going to be the people who'll be able to advise best on that.
2 minutes.
So so you can assure me then you'll make sure that he absolutely gets priority treatment, because, like I said, this is what he certainly deserves.
Of course, and I'm very sorry that you've had this, this bad 6 months, and the problem with your dad being sort of somehow lost in the follow-up. But certainly, we know now that he's got this problem, that he's got the bowel cancer, and we know that we need to get the cancer specialist to come and see him quickly and to make a decision about the best treatment and the best way to move forward.
Well, yes.
That's what we're going to do now, and obviously at the same time we're going to make this investigation to find out why there was this problem and why your dad wasn't followed up.
Well, yes, there's that as well, which, as I say, I shall be following up too, definitely. So you will keep us advised, as that's my dad himself, as to the progress, and you will be able to advise me what progress you're making as well.
Yeah, of course, about both those things.
Yeah, because no, as I say, I don't want any more slip-ups or oversights or anything to take place at all. Otherwise, as I say, we'll see how things work out a little bit, but I will be talking to the solicitors, definitely.
Sure.
Okay, well, we'll leave it at that, and as I say, if you prioritise the treatment, and let me know just as soon, let us know, or me, just as soon as it's underway, which, as I say, I would expect to be pretty, by tomorrow at the very latest.
Okay, well, as I said, the cancer specialist will come along to see him later,
and
then once they've seen him, we've got to wait for this sort of special meeting where they decide about the treatment. But once they've seen him, we'll have a bit more of a clear idea as to how things are going to move forward from
When is this special meeting? Is that going to be more delayed?
I don't know. We need to wait for the cancer specialist to come this afternoon.
Yeah, that's fine.
And then take it from there. They'll be able to advise us. And then once they've seen him, if you're not here while they do that, perhaps we can have another chat and I can update you as to what's happened.
Right, okay. All right, do that then. Okay. Is
there anything else you wanted to ask just at the minute?
No, I don't think so. No.
Okay.
No.
All right. Thank you very much.
Okay.
So there were lots of... Clearly he was very angry, wasn't he, regarding the treatment of his father. And he mentioned lots of things like negligence, solicitors, and it being somebody's fault. In that kind of situation, you alluded to a few of the different people that he could contact. Just could you outline, if he did want to complain about the hospital, where would he go, and who would he see, and what would be the process?
Okay, so as I sort of said to him before, that he'd be able to go to the patient advice liaison service. They're sort of going to be his first port of call, and they would, I guess, help explain to him about the complaints procedure
Yeah.
and you know, how best to proceed with that. Obviously, you know, he's perfectly within his rights to complain, so you know, if he wishes to do so,
Yeah.
we've got to basically help facilitate that. So then he would be asked to, or be assisted with writing a statement sort of explaining why he would, you know, what his issue was, what he wanted to complain about.
Yes.
And they would help forward that on to the relevant department, which in this case may well be the consultant sort of team who was originally involved in his care.
Mhm.
And then that would be investigated, you know, by that department, and then a statement produced to sort of in answer to that complaint, if you like.
And I think he alluded, you did mention PALS, and he alluded to the fact that they would cover up. And I think you said that they were independent. When you say independent, what did you mean by independent?
So I think I meant that they're sort of they're not acting for the hospital, in that they don't have anything to do with the investigation of the complaint itself.
Oh, okay.
So they're not you know, responsible for investigating or answering the complaint. All they're responsible for is sort of, if you like, advising him how and helping him with how to make that complaint and
Yes.
how to take that forward, and sort of being a liaison, if you like, between
Yeah.
the him and also the team that he's got the
But employed by the
issue with.
hospital.
Yes.
Yes. Yeah. And if he, I mean, they do all the advising to him. If he wasn't happy with the PALS kind of them trying to resolve it, has he got any other avenues of complaint?
Yeah, then depending on the nature of the issue, obviously he mentioned lawyers, but without going to sort of a legal team, then taking it to sort of the Care Quality Commission,
Yes.
or even to the Healthcare Ombudsman, if
Yes.
he sort of,
Yeah.
you know, depending on the scenario.
Yes.
And, you know, they, I'm sure, could certainly put him in touch with those people and give him the relevant
Yes. Yeah.
information so that he could contact them. But yeah, if he wasn't happy with the
Yeah.
hospital's response, that's what he could do,
Then
and
he
that
could
would be obviously independent.
Yes. Excellent. Good. Thank you very much.
Okay.
It was obviously a very difficult scenario about his follow-up being delayed. I think it was very well handled, the fact that, you know, often a delay in investigating things like anemia in the setting of a heart attack, you do have to wait. 6 months is probably a little bit long, and certainly he had some reason to complain, and I think that was very well handled, and he was pointed in the right direction. And initially he was very angry, wasn't he? And he was very upset. So I think giving him the time and space to express that anger was extremely important. So I think it was very well handled and very good scenario.